Mrs. Smith. How are you today?
I'm alright.
That's good. What brings you here to see me today?
I have actually just been diagnosed with rheumatoid arthritis.
I'm sorry to hear that. What have you been told about rheumatoid arthritis?
So far I know that it's an autoimmune disorder, which means that my body is essentially attacking itself and that there's some sort of genetic component to it.
Are you experiencing any symptoms?
Yes, in my hands there's lots of pain and swelling and in the joints as well as they feel warm or hot.
Okay, so we're going to take a look at rheumatoid arthritis on a more cellular level now.
So the genetic predisposition that we mentioned earlier is the HLA-DR4 protein that is on the MHC2 protein. Normally MHC2 surface antigen is on the B cell, which is then presenting itself and the foreign antigens to the T cell. Inflammation causes some of the symptoms associated with rheumatoid arthritis, such as swelling, heat, and pain. Normally, inflammation produces lots of proteins called cytokines. Inflammation is a process that is usually used to fight against foreign antigens and causes the B cells to produce antibodies. This is not the case with RA. It's still unclear what triggers rheumatoid arthritis. Some possibilities could be that the B cells have the HLA-DR4 marker, which presents the own antigen as abnormal and then sees as foreign to the body, or because the cells become infected with a microorganism which can bear a similarity to naturally present molecules in the joints. So the immune system is activated, the body then attacks both.
Okay, so both triggers activate T cells and B cells. Then B cells produce antibodies against itself. For instance, IgG antibody is produced normally during inflammation, but in RA patients, another self-produced antibody called the rheumatoid factor, or IGRF, reacts with IgG antibodies to produce immune complexes. B and T then interact and produce cytokines, which in turn attracts neutrophils and macrophages in the synovial joint. This causes a cycle where cytokines are produced, which in turn attracts more lymphocytes. Neutrophils and macrophages enter the synovium by squeezing through the blood vessel cells during vasodilation. So during vasodilation, there is increased permeability of the blood vessel wall, which allows for them to leak out into the synovium. Cytokines activated during cell activation are interleukin-1, which is secreted by activated macrophages. It promotes inflammation and T cell activation, and tumor necrosis factor, which are produced by lymphocytes and macrophages. It also promotes inflammation, enhances phagocyte, chemotaxis, and nonspecific killing. More immune cells are stimulated into the synovial cavity, which causes more inflammation. And angiogenesis occurs, which is the formation of new blood vessels in the synovium due to the formation of a pannus, which has a destructive effect on the adjacent cartilage and bone. It also reduces joint mobility because of the buildup and the pannus-filled erosion. WBCs penetrate cartilage, tendons, and ligaments, and the bone gets broken down.
So, homeostasis is therefore broken. There is swelling, bone damage. Eventually, it will spread to the rest of the body, but it usually starts with the fingers and the hands. So far, there's no cure for rheumatoid arthritis. Treatment is mostly for just symptom relief. But one of the tests that have been proven to be effective with rheumatoid arthritis is increased intake of vitamin D. So as a recap on some of the key concepts, we looked at the proteins that are involved in rheumatoid arthritis, such as the HLA-DR4 protein, as well as the MHC2 protein. Another protein that we also looked at are the cytokines that are produced by the B and T cell activation.
We also looked at the cell membrane and when vasodilation occurs and the permeability increases, which allows the macrophages and the neutrophils to go to the synovium. We also looked at homeostasis, which is the maintenance of constant condition in the body, and rheumatoid arthritis disrupts this. I hope you learned more, Mrs. Smith, through this information session today.
Yes, I think I did.
I wanted to say more after homeostasis, and I couldn't think